Hello, welcome to Podiatry Practice Mastery. Don Pelto here. Want to talk a little bit today about a visit I had to the office. There is a friend of mine. His name is Tom. And Tom, I think he was in one of my those things when I was trying the group sessions. And he is my buddy that I was in a mastermind with for a good period of time. And Tom used to run a car dealership, and they have these things within car dealerships called 20 groups, and it's not something within podiatry that we know anything about. But basically what they do is they all get together, about 20 dealers, and then they kind of compare their numbers, and I think they maybe white out what company is, or maybe they even just share them, and they share and they compare each other's numbers, and they see, hey, how is yours doing? How is mine doing? Why are you doing better in this? How can we help each other? And I think that's the whole idea of like a mastermind. And so that's what I'm kind of inquiring here. If anyone that's listening this is interested in forming kind of a mastermind like that, where we compare our numbers, this could be like monthly, it could be quarterly, whatever we decide, and we kind of see what's working for each other, what's working for you, what's working for me, and we help each other out. Now, there's not much bandwidth in my schedule to do that, but if a couple of people are interested and we have time that we could do it or chat, I would love to do that. Just email me. Don at podiatrypracticemastery.com. But anyway, I was talking about Tom because he referred over. Now he works for the Small Business Administration, and there's a place here at Clark University in Worcester where he works out of, and he is kind of an entrepreneur at heart. That's why he was part of my mastermind, and that's why he's referring over other people. And there's this new physical therapy practice in town, and they came over for lunch not to like have me refer so much, but more in terms of to kind of learn what to do or how to grow, getting patients and getting things like that. So what I realized is as I was sharing these things with them that it's quite an overwhelming process. Like I gave them like 20 websites and resources and things like that. And I think that's the reason I am going to make this boot camp. Basically, a boot camp will put the stuff you need to do in order. That's all it is, because I overwhelm them and with all these things. But let me go over a little bit about what I would recommend, and then when the boot camp comes, when I put it up there, you can kind of join that and do it in order. And we've talked about this whole boot camp concept before. But so basically, they're just starting a brand new physical therapy practice. Now, the interesting thing about their practice is it's going to be a cash pay, so like there's no insurance. And so I recommended a few things for them. I have interviewed a couple of people. One is a nurse practitioner. That's a cash pay nurse practitioner in her practice. I've interviewed another physical therapist that's local here. That's all cash pay. And then there was one other person that I referred to them. So my first thoughts for them is like sends like. So meeting some of the other professions that are in cash pay or concierge where people are paying a lot, try to get those ones because they may be good referral sources for you because the patients are already used to paying out of pocket. So that was my first recommendation, is make friends, and also make friends with even other physical therapists because they would probably help them. And that's the same thing with podiatrists. I know we all think we're going to eat our young, but really, if you want help and you're a nice person, most people will help you. I'm all about helping. That's what this podcast and these interviews are about. We can all help each other and do better. And frankly, most people won't do what's recommended anyway. Okay, so that's why you have to pay. When you pay, and then you tell you the same thing, then you're going to actually do it. Because if you tell them and it's free, they're not going to do it. If you make them pay, I don't know, $500 or $1,000 a month, and then you tell them, then they will feel obliged to do it because they're paying. But let's get off that rant for right now. So I'd recommend the first thing is they meet other people within the cash pay realm that would have similar patients that could go back and forth. The second thing I recommended that they would do, and I'm probably shooting myself in the foot, and I said you guys should probably buy a Shockwave. I'm a really big advocate, and I have a friend which I interviewed before, Dean Dorfman, and he does this on the knees and the hips, and I'm thinking, heck, if we can do it on the foot and keep real busy, if you're a PT, you could just do knees, hips, elbows, everything else with Shockwave, and you could do really, really well with that. So I recommended they buy a Shockwave, and I'm willing to help and teach them how to do that because Shockwave has really been a game changer for our practice, both focused and radial Shockwave. Then I kind of started in, and I'm like, well, but if there's really want to only do one thing, like, because you really have to kind of narrow it down what you can do one thing at a time, I recommended meeting those doctors and then getting online Google reviews. And I think that is so important right now. And the reason we get every patient I ask how they come in, and 100% come from Google these days. And because we have like 200 reviews or 300 reviews or more, and that's 200 or 180 more than our competitors. But you can't just do it by asking people. Like, I guess you could. Hey, could you give me a Google review? But you're not going to remember, you're going to be busy, things like that. It has to be automated. So the way we automate it, and I recommended they use this, is Patient Education Genius. So every time you send patient education information, it asks them for a Google review, or you could do it through your other medical record. So really the low-hanging fruit, I said, was getting these online Google reviews is really the best thing for helping them. And then I went and talked, and they said they were interested in doing like a podcast or and I said, well, don't do the same thing I did where I made a mistake. My first podcast, I think I told you about this before, was about wound healing. And I was trying to do a wound healing podcast, and I couldn't show any pictures because it was audio. A podcast is only audio. And I said, if you're going to do this on like physical therapy stuff where you're going to have to show them stuff, like don't do a podcast. Now, if you want to interview people about health topics, that's great. You can interview. I know some other physical therapists that are doing that. But if it's purely you want to show your technique, you should really do a video. You should do either Zoom meetings and put them on YouTube or something else like that. That's what I was telling them to do that. So the best way of doing that, I said, well, why don't you just practice and you can interview me? So I sent them a link to the way I do it is with Calendly. And once again, this is getting overwhelming, but Calendly is a way I organize my interviews. And I said, you guys can interview me and I'll give you the footage. And so I'm offering this as well to you that are listening to Podiatry Practice Mastery. Like, would you like me to, if you need content for your YouTube, okay, I would be happy to interview you about whatever you really like treating. And then once I interview you, there's two options. One option is you'll keep just the regular video file, and you can have me asking you the questions and then you just answering them, so it'll give you great content. And the other option, which I think is even better, is you cut me out of the videos by using Fiverr. You pay them to edit the videos, cut me out, just put a slide about the question that I'm asking you, and you're the one that can determine the slides, or the questions. And then just having you answering it. So that's the best way to get content and to get like good content on a certain topic is just to do little videos. And so what I would offer, if you guys are having a rut on how to do this, I could be your interviewer, meaning, we pick a topic, let's say plantar fasciitis, and then we develop some questions together, and then you just go off and I'll say, hey, what do you, Dr. So-and-so, what causes plantar fasciitis? Or what do you think the best way to treat it is? And then each one of these is a little video, and then you can either use the whole thing or just individual ones. I'd be happy to do that. If you're interested, just email me, don@podiatrypracticemastery.com. I think that would be fun. And I'm doing the same thing for this physical therapy group. And basically, I'll give you the link to my Calendly, and you'll use mine, but I'll get you the video, and you can use it however you want. That's the way to get really good content, is I think interviewing is much easier than writing. Now, if you don't want to use me, just have someone else. Like, have someone, to ask you questions and turn on the video camera and just record it. But I always find just doing it via Zoom or something else like that makes it a lot easier. And lastly, as we finish up here, be careful of overwhelm. Because if you have all these ideas, like this physical therapy place that visited me, you are going to be just in overwhelm. You're not going to do anything. You're going to be in paralysis. So pick one thing, kind of work on that, and then pick the next thing. Okay, kind of write them down, and really don't worry about, one thing that I've always struggled with is and I heard the analogy, I'm swimming in the ocean and I'm worried I'm going to miss out on some water. Okay, and this happens to me because I have all these ideas. I want to do this one, I do this one, and this one, and I want to make sure I don't forget anything. And what I've realized is that you're going to kind of get what's most important, what's the best for you is going to kind of float to the top, or it's going to float back. And pick whatever's the best thing at this point. That's going to be the thing that's going to either produce the most patients or produce the most revenue or produce the biggest result. And also it's something that you enjoy doing. Once again, stop doing stuff you don't enjoy. If you don't enjoy writing, don't write, do videos. If you don't enjoy doing videos, do something else. If you don't enjoy doing any of this stuff, just get a job and have someone pay you, okay? So just do what you enjoy. If you only enjoy surgery, only do surgery. And if you only enjoy surgery or sports or something like that, only do videos and content on those topics. Like, don't talk about wounds if you don't like doing wounds. That was my big error in the beginning. I have all these wound videos now that are really old that are really producing a lot of content. And I have like people from Zimbabwe contact me about my wound videos, and I don't even like doing wounds anymore. And so just really be careful and kind of dial down on the content that you're doing. I really admire once again, there in Washington, Larry Huffman, because he likes orthotics, and all of his videos are an orthotic he's showing, and that's all he's doing is orthotics, and that's all the videos he shows is orthotics. And so if that's what you want to do, only do that, if that's what you're passionate about, okay? Once again, hope you found this helpful. Go to Podiatry Practice Mastery, join the membership. I got a ton of content there, and I'm going to be making this boot camp for you. Please give me insights, what you think would be good in this boot camp, and then we'll kind of go from there, okay? Great. Have a nice day, guys.